much for making time to join us. We'll now move to the national anthem. Please play for us the national anthem. Are we good with the national anthem?
No sound.
There's no sound on the national anthem.
We can sing Prezo. Yeah.
All right, Dr. Diana, please lead us on the national anthem.
Emu yetu ilete baraka
kwetu tukae na undugu, amani na uhuru, raha tupate na sawi.
Thank you very much for that. Object of Rotary by President Jane Njagi of the Rotary Club of RC at the River.
Right, good evening once again. Glad to take you all through the object of Rotary. And I begin. The object of Rotary is to encourage and foster the ideal of service as a basis of worthy enterprise, and in particular to encourage and foster, 1, the development of acquaintance as an opportunity for service. 2, high ethical standards in business and professions, recognition of worthiness of all useful occupations, and the dignifying of each Rotarian's occupation as an opportunity to serve society. 3, the application of the ideal of service in each Rotarian's personal, business, and community life. And 4, the advancement of international understanding, goodwill, and peace through a world fellowship of business and professional persons united in the ideal of service. Thank you.
Thank you very much, President J. The 4-way test by President Edith of the Rotary Club of Enkare Narok. President Edith? If she's not ready, Brenda, please take us through the 4-way test. Rotarian Brenda.
Okay, thank you, Prezo. So we can say it together. Of the things we say, we get together.
Of the things we think, say, and do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you. If you have a glass, please charge it. If not, please place your left hand across the chest as we toast to the President of the Republic of Kenya. To the President. All right. Thank you once again, our dear Rotarians and non-Rotarians who've made it for today's discussion on HPV DNA testing. My name is Ruth Munyi, the President of the Rotary Club of Nairobi Thika Road, and I recognize all my co-presidents who have joined this evening, as well as the district officials. In 1 minute, I'd like to invite the district membership chair, Rotarian Junior Yasin, just to tell us briefly what Rotary is all about, because I do understand we have non-Rotarians on the call. Rotarian Junior, over to you. In 1 minute, please.
Thank you so much, Prezo. I hadn't prepared for this, but yes, I think as a Rotarian, you need to always be prepared. So Rotary is it's a global network of around 1.4 million members who were united to create lasting change across the globe in our communities and also in ourselves. So Rotarians basically are people who come together from different professions and vocations, and we all bring our minds together to use our vocations when we are serving the community. So we bring our ideas, we bring the different backgrounds that we have so that we're able to serve the community. So the bottom line of Rotary is service above self, which is our guiding principle. And this actually helps us to serve the communities that either are part of us or even that are far off from us. The bottom line is we have to serve. And then with that, then also it also brings together the people of, if we have different vocations, you've heard people talk about networking. Yes, we also network together. We learn from each other, we fellowship. What we call fellowship is basically the coming together that you see today. We have social gatherings that we also have, but the bottom line is we learn from each other. We learn to work with each other, but we also have to serve the communities. We are guided by the principles of Rotary, the 4-way test, as you've had been mentioned. And also we give funding to the Rotary Foundation, which is our biggest, one of the biggest foundations we have globally. And this helps us to actually run programs globally. So whether the program is in India, whether it's in Nigeria, whether it's here in Kenya or anywhere in our district, we are actually able to tap into these funds that are contributed by Rotarians. And Rotarians are volunteers. So these are people, we are people who, yes, we have different professionals. We have doctors, we have, as you've had, engineers, but yes, we volunteer and come together to serve the common good. So our district, as it is, you'll hear it's being mentioned. So we are in District 9212, which is, that is from the global perspective. And this is made up of Kenya, Ethiopia, South Sudan, and Eritrea. We are a total of 154 clubs in total, the entire district, made up of about 4,000 Rotarians. So if you really want to join Rotary, please reach out to any Rotarian here on the call. I know there are people who will answer your questions regarding Rotary, and you're free to join any club globally. Actually, at any club we have, even here, you can join. You just need to raise your hand, then they'll share with you the details, the information that you need to fulfill. And yes, we welcome anyone, and we always believe more hands, the more hands we have, the more service we have to the community. I believe that is just a summary of what, of who we are. We'll be ready to answer any questions. Thank you,
All right.
Madam President.
Thank you very much, our district membership chair. Should you have any questions that is in relation to Rotary, please feel free to put them on the chat box and we shall have our Rotarians responding to them. Allow me to kindly request the clubs represented here, if you have any announcement, please as well put them on the chat box. We shall announce them much later on after the webinar. So right now, I'd like to hand over the forum to Dr. Diana Wangeshi to please take us through today's topic, as well as introduce the guests to us. Dr. Wangeshi, over to you. Thank you.
All right. Good evening, everyone. My name is Dr. Diana Njuguna, and my classification is health. I am a nursing lecturer and a cervical cancer researcher at the Kimathi University of Technology in Nyeri, and I'm very passionate about prevention and health equity in our communities. So before we begin, I'd quickly like to give a disclaimer. You all know why we are here today. So Prezo, allow me to just share something. All right, so the Rotary Club of Nairobi Thika Road is only facilitating disease awareness, cervical cancer awareness, and we are not providing any medical services. And all the HPV DNA testing results, referrals, counseling will all be handled exclusively by DKL. As you know, we've been having a series of these cervical cancer awareness, and at the end of it all, we are going to do a mass screening for the women in Rotary, the women in this club, and even our family members are all invited. So the laboratory in line, the DKL laboratory is in line with the Kenyan regulations, and what we are saying is that RC Nairobi Thika Road does not store patient or medical data, it does not interpret results, and also it does not offer medical advice or collect any payments. So all the payments that are going to be made and costing per test will be managed directly by DKL Lab. So all guidance on next steps for both negative, positive results are all going to be covered in the qualified panelist presentations today by Dr. Ahmed Kalebi. So make sure you ask all the questions you have, as well as Dr. Maina Wangoiko. So the participation in the testing is going to be voluntary and confidential. The Rotary Club of Nairobi Thika Road role is limited to awareness and coordination of support. So you're welcome, and this is by the Medical and the Governance Committee of the Rotary Club of Nairobi, Thika Road. So allow me to proceed. So please consult your healthcare provider in case you have any individual concerns. So to help us gently ease into this session, we are quickly going to start with a quick anonymous poll because you are aware that we've been having a series of these webinars. We had a face-to-face panel expert presentation about cervical cancer screening. So kindly note that there are no right or wrong answers. And basically, this is just to warm us and ease us into the meeting. And I invite all of us to reflect for the moment. And then please answer the question. And I'm going to be sharing it with you on the screen. Please open on your phones, Slido, and then enter this code that I'm going to share. So let me know if you're able to see my screen. Please. All right, so there we go. So cervical cancer can almost always be prevented with regular screening and HPV vaccination. So just log on to your phone, look for slido.com, and then enter this code 2500435. And then you can have your answers. This is just to be able to just gauge us, whom do we have in the room, help us to plan for this session. So just please choose the option that best fits you. We don't have a right and a wrong question. We are all here to learn. Thank you so much for the responses that have come in. So most all of us agree that screening and HPV vaccination can help us prevent cervical cancer.
What's the code again?
The code is 2500.
Maybe you can type it on the chat box.
All right, just give me a minute. Miss multitasking. 2500435. You have it? All right, so we move to another icebreaker. So we are going to learn about HPV screening today, HPV DNA testing. So if my HPV DNA test is negative, I never need cervical cancer screening again. Is it true? Is it false?
False.
Thank you so much for those responses, 100%. And I'm happy because we are making impact because we are able to make the right decision. And we have an 8% that says it is true. And I believe Dr. Kalebi is going to help us put everything into perspective, and we'll be able to answer, to have the right answers with us. So we are pleased to have our panelists, Dr. Ahmed Kalebi and Dr. Maina Angoigo and Jennifer Munai, cervical cancer survivor. And I'd like to invite Brenda to give us a brief intro of Dr. Kalebi, who is going to help us understand HPV DNA testing, what it is, how it works in the lab, what the results mean for every patient. So over to you, Brenda. Rotarian Brenda.
Thank you so much, Dr. Wangeshi, and welcome all to this webinar. I'm going to take you through Dr. Kalebi's profile. Okay, I'll start. So overview, Dr. Ahmed Kalebi is a Kenyan medical doctor, pathologist, and pioneer in diagnostic laboratory medicine in East Africa. He specializes in general and anatomical pathology as well as laboratory medicine. Education and early years, he earned his MBCHB from the Nairobi University in 2001. He went on to get a master's in general stroke anatomical pathology, MedPath, from the same university in 2005. Later, he obtained qualifications including FCPath, South Africa, in anatomical pathology, and FCPath, ECSA. Sorry, I said South Africa, but it's written SA, so it's SA, and then FCPath, ECSA, in 2009 and 2012, respectively. Career and contributions. In 2009, he founded Pathologists Lancet Kenya, part of the Lancet Group of Laboratories, East Africa. He served as Group Managing Director, CEO, Chief consultants pathologists until April 2021. Under his leadership, the Lancet network became the largest internationally accredited private lab network in Kenya and the region. After stepping down, he started working as an independent consultant pathologist under his own company, Ahmed Kalebi Consultancy. In late 2025, he launched a new diagnostic venture, Dr. Kalebi Labs DKL, in Upper Hill, Nairobi. The lab boasts total lab automation and aims to improve accessibility and speed of diagnostic services. Recognition and impact. He has been repeatedly featured on the global power list by the journal The Pathologist magazine in 2019, 2020, and 2021. More recently, 2024 and 2025, he was named among the top global pathologists and one of the top 50 innovators in laboratory medicine. His work has been especially influential in raising diagnostic standards, improving lab accessibility, and promoting modern lab medicine across East Africa. Personal and background and community work. He was born and raised in Kibra, a low-income area of Nairobi, a humble origin which shaped his commitment to accessible healthcare. Beyond his lab work, he holds leadership and board positions in several organizations. For example, he is on the board of the Independent Medical Legal Unit, IMLU, among others. Through his career and ventures, he has created job opportunities and facilitated improved health services, especially for communities that previously lacked access. Thank you so much, Dr. Diana. I take this back to you.
Thank you so much, Brenda. So I'd like to give Dr. Kalebi just a minute to just say hi to us before he can now dive into what he's going to talk to us about today. Over to you, Dr. Kalebi.
Hi, everyone. As mentioned, my name is Ahmed Kalebi. It's lovely to be here with all this vibrant community. I thought we were going to start at 6:30 and I was a bit late for prayers, and then got to enjoy all the greetings and introductions. So quite vibrant. It's really been lovely. I look forward to some very good discussion. Let me give a disclaimer. I didn't know that I was supposed to be talking and giving a lecture, but I can speak anytime. I thought it was supposed to be a discussion between the three of us on the screen with the host, but let me know whatever you want me to say, I'll say.
All right. Thank you so much, Dr. Kalebi. So as the other panelists introduce themselves, maybe you can be preparing in your thought process. So what we need to learn from you is just to understand the HPV DNA testing. What is it? How does it work in the lab? You know, why are we recommending it? And what do the results mean to our patients? So that is what we needed to talk about. And then we'll have our obstetrician gynecologist be able to explain to us after the results what next. And then our panelist, Jennifer, is going to give us about her journey throughout the trajectory from diagnosis to survivorship. So I hope that is clear.
Kabisa.
Asante sana. So next we have
Sorry, quick question.
Yes.
Are we recording this session?
Yes, it is supposed to be recorded.
Thank you very much
It's
indeed.
recorded. It's being recorded.
Thank you very much indeed.
Thank you, Jerry. So next we have Rotarian. We are pleased to welcome Rotarian Dr. Maina Wangoigo. He's an obstetrician gynecologist. He is a HIFU specialist, specializing in high intensity focused ultrasound with an extensive experience in caring for women. He's also an advocate for women and sexual reproductive and health and even the rights. And he's currently a gender studies and a community development master student at the Great University of Nairobi. His research interests are in female sexual dysfunction, and he's also a very proud Baba Girls. And we are honored to have Dr. Maina with us to share his practical insights and to be able to answer all our questions. So Dr. Maina, thank you for joining us, and we invite you to briefly just say hi and introduce yourself. Karibu.
Hello and good evening. I hope I'm audible.
Yes, you are.
Yeah, thank you so much for having me. As Dr. Diana has mentioned, my name is Maina. Maina Ngoigo is my name, and I practice obstetrics and gynecology, and recently new technology called high intensity focused ultrasound, which is basically technology to treat fibroids without having to undergo surgery. Above that, of course, through my own work and through my social initiatives, I'm a social advocate of women rights, both sexual and reproductive. I'm glad to be here, and also especially honored to be alongside my esteemed colleague, Dr. Ahmed Kalebi. And thank you, Rotary Club of Thika Road, for having us.
Thank you so much. It's called the Great Club of Nairobi, Thika Road. Karibu sana daktari. And we are honored to also be joined by Jennifer Munai. She's a cervical cancer survivor and a strong advocate for women's health. So Jennifer is has an MBA in finance from University of Nairobi. She is a founder of Jennifer Cancer Foundation, which normally gives hope to cancer patients and also provides information. She normally organizes and does a lot of cancer screening throughout the year, raising funds to support cancer patients and survivors. And she is a science teacher in one of the schools in Mombasa County. So she's going to share with us. So Jennifer has generously agreed to share her personal journey with us through diagnosis, treatment, and even survivorship. And she's able to share with us what cervical cancer prevention and early detection now mean to her. So we are deeply grateful for her courage in speaking with us today. So please join me in warmly welcoming Jennifer. So Jennifer, please unmute and say hi to us.
Hello. My name is Jennifer. Jennifer is a teacher by profession, as you've heard. I stay in Mombasa. That is where I teach. And currently Mombasa is very hot. I hope you're not hearing the sound of the fan. Cancer awareness champion. I decided to call myself like that. If I'm not wrong, we met with Dr. Kalebi in 2017, somewhere when I was doing a biopsy. I believe you are the one. And last month, I was appointed a member of ASCO. It's an American body whereby I will be representing the cancer patients in the research in cervical cancer research. Now, one thing I would want to remind all of us is that most of the time when a cancer patient is said to give her story, people are usually very quiet, very attentive. And I wish it can be demystified that cancer is like another disease. It's true that it causes a lot of havoc in somebody's body, in somebody's pockets. But it is important to know that we don't need to fear. So let us open our hearts, open our minds, and listen and see what we can carry from here. Thank you, Diana.
Thank you so much, Jennifer. It's always a pleasure having you and just getting to listen to you speak with the passion that you have. So I'd like to request our panelists, even as we proceed, we can be able to see the questions that are in the platform so that we can also prepare as we speak. We can be able to respond to those questions as we respond to, as we speak, as we share what we are supposed to share. So without much further ado, I'd like to invite Dr. Kalebi to take us through demystifying and just helping us to understand what the HPV DNA test is all about. Over to you, Dr. Kalebi.
All right. Hi, everyone. And once again, it's quite an honor to be here amongst you Rotarians and this wonderful team. I'd also shared on my social media, so I think quite a number of people have joined who are not Rotarians. So I'll try and talk about HPV testing and HPV and cervical cancer in sort of, in about 5 minutes, try and put everything into perspective. I'll probably be oversimplified at the risk of even not sounding scientific or medical, but I know a lot of people who are here, including Jennifer, will appreciate this. So let me start by saying we are here talking about cervical cancer. Cervical cancer is the top leading cause of cancer deaths in Kenya and one of the top in Africa, much less in other parts of the world because they have basically eliminated cervical cancer, but it's still a big problem for us next to breast cancer. But the most important reason why we are actually talking about cervical cancer always is because it is the one and the only cancer worldwide, only known cancer that is 100% preventable. And when you say 100% preventable, it means it can be prevented. Somebody can be prevented from getting the cancer in the first place, and when they have it, when they're developing it, it can be cured completely before it becomes advanced. Things like breast cancer, you can try and detect it early, but to prevent it is not possible. Things like, unless of course the breast has been removed. There are many other cancers that you cannot do anything about, but cervical cancer is something you can do something about. Now, why are we talking about cervical cancer and HPV? Somebody even asked, but HPV is also of concern for men. Let me start with that first, because it will put the message home. The cervix, and I think most of the people here are women. I think when I looked, only women have cervix. Men don't have cervix. That's a defining feature of women and not men. Problem with the cervix is it's hidden. So most people don't even know they have a cervix until they are told. And the ones who are told, they'll never see their cervix. They'll never feel it, perhaps, because it's hidden. And that's the problem. Because it's hidden, anything that goes on in the cervix is also hidden. Unlike for a man, most men, at least, will be able to see their penis. And if there's something affecting the penis and causing a problem in the penis, unless the man ignores it, the man will be able to see if there's a problem in the penis and go to a doctor or do something about it. But for the women, however diligent you are, however good of a woman, and you might be a doctor, if there's a problem with your cervix, you will never know. Now, that problem can be cancerous. Okay? And how does this cancer develop? This cancer develops because, like all cancers, something goes haywire in the way your body, the cells in your body are multiplying. To just put it into context as well, all of you, you can just think about your lips. As I'm talking right now, my lips have what you call a mucus. This part is basically in the GI tract, in the vagina, and so on. That mucous membrane, the cells in it are very, very active. And one of the most active areas is in the cervix because it multiplies normally a lot. But when something goes wrong, what we call a switch, there's a switch that is switched on and the cells start multiplying uncontrollably. The reason why our body looks as it is, our lips, our eyes, our skin, it multiplies in a particular organized manner. But when cancer develops, it means it starts multiplying haphazardly. And if those cells are multiplying very rapidly, they destroy other cells around them. So that is the background to it. Now, in the cervix is actually a very small, fairly small organ, right at the end of the vagina. The vagina is connected to the outside because there is the vaginal orifice, so it's open. And a lot of things go into the vagina and out of the vagina. Now, anything that goes into the vagina and eventually gets into the cervix, it can cause problems there. We have a lot of infections. A lot of these infections, chlamydia, gonorrhea, HPV, will infect the cervix. The problem with HPV is that when it infects the cervix, it becomes what we call precancerous. So what is this HPV? HPV is full name human papilloma virus. It is one of the millions of viruses around the world that known and unknown to man. But the HPV virus itself is what we call a DNA virus, which means it's a fairly big virus. It is very, very hardy. In other words, it can't be destroyed easily. It's not a very delicate virus, which means it can survive for long in the vagina. It can survive for long on the penis or the skin or any surface. Now, HPV, there are many types of HPV virus. Many of you know about the HPV virus, probably. It's what causes the skin warts, genital warts. most people will be exposed to HPV in their lifetime. The most common HPV is the one that causes the skin warts. You've seen people with skin warts. They look like, some of them look like mashilingi, some of them look like a pimple and it goes away. But the one that causes cervical cancer is, there are 14 of them out of over 100 type of HPV. Actually, HPV was the first virus discovered to cause cancer, and it led to the gentleman who discovered it to get a Nobel Prize. And this HPV, there is what we call the high-risk HPV. That's the most important message. There's what we call the high-risk HPV. It can infect the vagina, the cervix, it can infect even the mouth, the throat, and wherever it will infect, it can lead to cancer. And that's why you hear about people getting throat cancer because of HPV and other areas. Why is the cervix the most vulnerable? And why is it the most lethal? Because the cervix is hidden. It is an area of the body where there's a lot of multiplication. So when that virus infects the cervix, it triggers certain reactions that can lead to cancer. Now, I'm going to draw a bombshell here. I'm sorry to pause for effect. Most of you should know this, that majority of women in their lifetime will get exposed to HPV. Actually, statistics show more than 70 to 80% of women will get HPV at one time or another in their lifetime, as long as they ever get sexually active. This is a very, very important message, that HPV is not transmitted only sexually, is not only transmitted amongst those people who have sexual intercourse, physical sexual intercourse, male penetration of the woman, but it can be acquired through any form of sexual contact. And when I'm talking about sexual contact here, let me be very, very clear. We don't talk about the sexuality and promiscuity, no. Normal sexual contact, even among women and women, even with sex toys, can lead to acquisition of HPV. Where is this HPV that gets acquired into the cervix, into the vagina, acquired from? Where is it normally found? It is found most of the time on the skin of everybody. So men, women will have HPV. It is so ubiquitous. In fact, if you have a boy who has lived all his life without any sexual contact, and a girl who has had no sexual contact in all their lives, so they got married when they got over 18, or they had their first sexual contact, only the two of them, and they remained monogamous all their lives, they will still acquire HPV. And the girl will still get HPV, more than 80–90%. So any woman is at risk of getting HPV infection. Let me just switch gears a bit to give you guys a better perspective. It is like mashilingi. You guys know about mashilingi, fungal infection, tinea corporis or tinea capitis, what we call mashilingi, that can cause infections on the head, on the skin, on the beard, wherever. Mashilingi is everywhere because fungal infections are everywhere, right? So you cannot say that the person who gets mashilingi, the person who gets fungal infection, is unhygienic, is this and that, because you've even seen some of you, your kids come home and they have mashilingi because of whatever contact they had. So the HPV is a virus. Fungal infection is caused by fungus. This HPV can find its way into the vagina, even between a monogamous couple. Now, finally, to bring it closer home, is that when this HPV infects the cervix, it does not just cause cervical cancer immediately or instantly. In fact, 90% of the women will eradicate the infection spontaneously. Why? Because God gave us immunity. All of us have immunity. Whenever I get exposed to infections, we will tend to clear it. So more than 90–95% of women who will get HPV, just like men, they will clear it. But it can take time. However, if that woman gets exposed to high-risk HPV, of which, as I told you, there are 14 subtypes, and the most high risk, the toughest one, is called type 16 and type 18. Those are bad news HPV strains or HPV subtypes. The women who will get that, if they don't clear it, they are on track to getting cervical cancer. And that is why it is encouraged to get HPV vaccination, because if a girl gets vaccinated at age of around 9 to 11, by the time they actually get sexual contact, not because they are promiscuous or anything, even if they just got married to a priest and only the two of them will ever be with each other, she can still get the HPV. So, as somebody says here, is story of men causing HPV is a lie. True, it is a lie. It is a lie because men and women are all just innocent carriers of the HPV. So the man does not go infecting. So any woman who gets HPV does not mean that the man who she was with is the one who brought it because he was promiscuous. And I think I really want to emphasize that, because if we don't demystify, Jennifer says we must demystify. And I spend a lot of time on this point. If we don't demystify this, that is why people tend to avoid, for example, vaccination, because they say, why should my kid get vaccinated? I don't expect her to become promiscuous. There's nothing to do with promiscuity. Somebody will say, why should I go and test? If I find I'm having HPV, it means there's already that stigma. It is not. All of you women here, especially the young ones, you are going to get HPV. The old ones, either they have, now that's the point. The older ones, either they have cleared the HPV, or if they have failed to clear it, it is now brewing cervical cancer. Finally, how does it happen, the cervical cancer? When the cells in the cervix get infected and you fail to clear the infection because you didn't have immunity, you're not vaccinated, it starts multiplying slowly. Think about it like, I just thought about this example, like an ant, like ants. So if you have your house at some corner somewhere, ants come, they're not just gonna cause destruction immediately. They start with small things, then they start growing there. Eventually they'll eat the whole wood or whatever. It doesn't happen overnight. It takes between 10 to 20 years to start from the time it's infected, the cervix gets infected, to it developing cervical cancer. And because it happens gradually, you can actually see what we call precancerous changes. That is why we used to do pap smear. You all know about pap smear. So pap smear, we collect the cells from the cervix, we look at it under the microscope. It was discovered, that technique was discovered by somebody called George Papanicolaou. That's why I call it pap smear. And it saved a lot of lives. I think the guy is straight in heaven. He should have been a Rotarian. Yeah, he saved a lot of, lots and lots of lives. When we pick that, those cells that are abnormal, and we see them, people like Dr. Maina will go and treat that cervix. They cut off a small part which is infected or affected, and it will prevent cancer. Even if the whole cervix is involved, as long as it has not spread, it can be prevented. That is why going for pap smear and going for examination is important. However, the world has moved, because we now know HPV causes all cervical cancer, literally, except one called minimal deviation carcinoma that it does not kill. So for all intents and purposes, go home with this message that cervical cancer is caused by HPV. And if we are able to prevent HPV through vaccination, we can prevent cervical cancer. And if we are able to test and pick whether a woman has HPV, it means we can now look to see whether she's at risk or she's developing cancer. But for the woman who is HPV negative, it means she has zero risk of developing cervical cancer. Zero, absolute zero. Remember that. So since more than 90% of women don't have HPV, they don't have a risk of cervical cancer. It goes without saying that if you test yourself to find out if you have HPV and you are HPV negative, it is very, very good news for you. It means you have no risk of cervical cancer, and you can be tested after 5 to 10 years to see if maybe you have acquired a new strain of cervical cancer, of HPV. However, for the woman who is HPV positive, it is good to know. And knowing that you are HPV positive is actually good news, because it means now I know I have this infection. Now I need to check, has that infection created any changes that are precancerous? If so, I can be treated. If it has not caused any precancerous changes, I can be followed up. Failure to know whether you are HPV positive or negative means you are sitting there blind, things are cooking inside you, and to be honest, that is quite silly. Let me try to be very polite. That is quite silly. Somebody can say a better word. It's like saying that I don't care whether there are ants in my house and they are eating the wood or furniture in my house. I don't want to know. That will be kind of quite stupid. You really want to see whether there are ants, you get insecticides, blow them away, and you protect your house. So your house is the cervix. It is very important. You'll never see anything, and you don't wait until you have symptoms, because the minute you have symptoms, Dr. Maina will tell you it is too late. But if you pick it early, you can be 100% cured. HPV testing is now fairly widely available. In our lab, we do it routinely. You just walk in. And in fact, the good thing is that you don't even have to go to a gynecologist. Sorry, Dr. Maina. We can do what we call self-collection. It's just a swab, like an earbud. You put it in the vagina, bring it to the lab, and we test it for you. Once we test it for you, if it is positive, we refer you to the gynecologist. They examine the cervix carefully, and they'll know what to do, because if there's any changes, they will treat. If there's no changes, they'll follow you up. If you are negative, you are told, stay away, don't worry, don't even stop about your sexuality, because if you ever get HPV later, your body will clear it, and if it doesn't, after 5 to 10 years, we can test you again and see. So finally, I can see somebody asking, and I might answer it now, is it available in all hospitals, including public hospitals? HPV DNA testing is now widely available. It's actually covered by SHA for civil servants, teachers, and for people who the gynecologists will recommend it. It is widely available in most hospitals nowadays, and even the hospitals and labs that don't do it, they are able to collect the samples and send it to a lab like ours that does it, which means you don't actually have to go walking around, just go to your nearest doctor. So I think because of time, I will stop there and perhaps allow others to talk, and we can answer questions that will come up. Thank you.
All right. Thank you so much, Dr. Kalebi. Let's give him a show of appreciation. I think we have learned something. At least each and every one of us has something to go home with today. I'd like to invite Dr. Maina Wangoigo to shed some light on, you see, our slogan is early detection saves life. How are we detecting it? So just talk about the screening, and then we'll come back to Dr. Kalebi, who is going to talk more about the HPV DNA testing in particular, because we have some questions that are asking about its sensitivity, its accuracy, and I think you're the right person to shed some light on that. Over to you, Dr. Maina.
Thank you so much. I hope I'm still audible.
Yes, you are loud and clear.
Yeah, thank you for the opportunity. And of course, I must start by congratulating and appreciating Professor Kalebi for, I mean, I think he has really just summarized everything a gynecologist can say about, cervical cancer, and especially with respect to HPV, of course, apart from the management bit. And I think let me just start, first of all, by, putting across just how significant this issue of cervical cancer is, because it's becoming an increasing burden even among elite women, because traditionally it's thought that women maybe in the rural areas, or maybe the ones who lack education, are the ones who haven't done testing. But statistics from previous surveys by government indicate that our screening uptake rates are a paltry, around less than 20%. Basically, less than 20% of the entire target population is quite wanting. And as Wangeshi had correctly put, Every year we are seeing more than 5,000. I think the last statistics were showing 5,800 new cases yearly, which is quite worrying. And I think this is actually an understatement, because an underestimation, because there are other, undiagnosed cases. And we are seeing that we are losing about 3,500 women every year to cervical cancer. And simply put, this is, with my other professor, we try to liken it to, like, for example, buses, these buses that carry people, or matatus. If you're losing 3,500 women to cervical cancer alone, that is basically about 250 14-seater matatus of women. You can imagine that translates to more than 20 buses, matatus per month, crashing and everyone dying. That's how significant this thing is. Now, going to the question of screening, the reason why there is increased lobbying and, of course, conversations around this screening issue is because we are falling short of targets by WHO. We are only 5, maybe 4 years actually, because 2025 is almost over. We are almost getting to 2030, where our target basically is to have more than 90% of all eligible girls being vaccinated against HPV by age 15, and and of course that is the vaccination, which is now widely available, and 70% at least of all target women having undergone a high performance test, that is of course something like HPV or a pap smear. And 90% of all those women who have either precancerous lesions, these are basically changes in the cervix that have not become cancerous, but they are on their way to get there. And 90% of all those who have been found to have cancer, basically disease that has already established, being treated. So we are falling way, off target. So in terms of screening, the general recommendation is actually quite steep. The WHO generally, which is a guiding body, recommends that girls should start screening with pap smears even as early as 21 years, but not later than 25, because of course there are many factors that may affect uptake of this screening test. So all girls at least by 25 years should be able to start doing pap smears, and thereafter every 3 years, assuming they have a negative result. For those who are HIV infected, because the risk of having this basically these cancerous changes or precancerous changes in their cervical cells, their screening is a little bit more frequent. So for HIV positive women, their screening is supposed to be every year to do a pap smear. Of course, now technologies like doing HPV DNA screening, the recommendation currently, is to have, girls and women to do HPV testing at least by the age of 30. And to emphasize the need for increased HPV uptake, the recommendation is to have a minimum of 2 tests of HPV in a lifetime. So basically, by the time you're about 30, 35, you've done a test. And by the time you're 45, you've done a second testing, because as Dr. Kalebi correctly said, the fact that you can do a test and it turns negative doesn't mean, number one, that you can get newer strains or newer types of viruses, because there are hundreds of these kinds of human papilloma viruses that exist. And therefore, if you today, if you do a HPV test and it's negative, it doesn't mean that if you test 5 to 10 years later, you will not have either high risk or even the low risk. Remember, whereas we are also interested in, in the question of high risk viruses that cause cervical cancer, we are not oblivious of the fact that these other low risk viruses also portend other, health challenges like, warty lesions and basically, lesions that are caused by the low risk viruses, apart from 16 and 18, which are the high prevalence oncogenic or cancer forming viruses. Now, you see, once you do a HPV test and it turns negative, and I think I will marry this with what someone asked, how reliable it is. A HPV test is highly reliable In terms of reliability of tests, we look at mainly two things, what is called sensitivity and specificity. If I'm to simplify this, sensitivity is basically to say that this test, the HPV test or whatever test, when we talk about the sensitivity of a test, is to mean that it can actually correctly pick all women that have a particular condition. So if you're talking about, let's say, HPV, if indeed you have HPV, the test is able to actually pick. So if you do these tests and you indeed have HPV viruses and it picks you to have it, then it means that it's sensitive to basically the HPV testing. And when you talk about specificity of a test to determine how accurate it is to mean that if you do not have, it's basically having a negative results, and in truth, you actually don't have the virus, basically a true negative. So it doesn't give you a negative result and yet you have the virus. It gives you a negative result for the virus and indeed you don't have the virus. And when you look at the sensitivity of the HPV DNA testing, it's actually more than 90%, meaning that it can, out of 100% of samples, 90% of those it picks to have the the HPV actually do have these viruses, and the specificity of this test is more than 85%, which means that 85% of the times, if it rules out presence of HPV, indeed you don't have it. So it's a highly reliable test. Of course, the pap smear is equally important. It may not have such high specificity. Sometimes you can have false negatives, sometimes false positives, and these are of course attributable to sometimes collection techniques or even cross contamination, or sometimes resemblance of viral particles with maybe other viruses. So, of course, is the concept of what is called co-testing, that is doing both HPV testing and pap smear. Remember, and this is of course something that Dr. Kalebi has alluded to, having HPV virus, even the high risk, does not necessarily mean you have cancer at that particular point. And I think this is important so that people are not afraid, because every day in the clinic I get women telling me, daktari, ile kitu sijui haiwezi niua, which I don't find it to be, to be a good outlook of things, because when you know a condition, or when you know maybe you have viruses, for example, you'll be triggered to take the next, step. And that therefore means that even if, for example, if you do a test and you have a result as HPV positive, now the question is, has this virus, number one, is it a high-risk virus? Yes or no? High-risk viruses are those that are oncogenic or cancer forming, or cancer, those that increase the risk of cancer. So if you have the high-risk viruses, if they are present, so what next? We have to ask ourselves, have these viruses actually caused either cancerous or precancerous changes to the cervix? Because as my esteemed colleague had mentioned, the body is made in such a way that it's able to fight most of the viral particles, most of the bacterial particles, even most of the fungal infections. And generally, viruses, and because almost all of us or most of us maybe have been exposed in one way or the other to these viruses, within a period of about 24 months, the body is able to clear these viruses. But some of these viruses are quite resistant or very hardy to the immunity, in such a way that the body's immunity is actually not able to clear these viruses from the body or from the mucous membranes, and therefore the persistence of these viruses in the mucous membranes is actually what leads to this transformation, or basically these cancerous changes, by basically altering the cell division mechanism of the cells. Because remember how we are created, we are meant to be self-regulating. The body is designed in such a way that body cells can multiply at a particular rate, but they're also controlled. They have scheduled cell death when they age, and multiplication of cells in a controlled and regulated manner. But when these viruses joins the cell, and the the DNA material, the genetic material of this virus combines with that of the normal cell, then it diminishes, or basically destroys the autoregulation of the normal cell, to multiplication, and this leads to uncontrolled multiplication. So when you have persistence of these viruses, that's when you're at risk of getting, cancerous and precancerous changes to the cervix. So if you get HPV positive, what you're supposed to ask yourself is, has my cervix undergone some changes? How would you know that the cervix has actually undergone some changes? Now, this is where the question of pap smear comes in. The pap smear is actually a cytological test. Cytological is basically to mean it just collects cells in and around the cervix to take them to the lab for them to be examined by pathologists like Dr. Kalebi to be able to determine, is this cell a normal looking cell based on various parameters that determine what is normal, or is it actually an abnormal cells? Because cells are from, I don't know whether this is a science, it was a science or a biology lesson, have things in the center called nuclei and something called cytoplasm, basically the environment within the cell. So the different changes within these cells can actually be seen under high magnification microscopes, and we can be able to tell, has this cell changed from normal to abnormal? So that will determine how significantly changed or how significantly different or similar is this cell to the normal cell. Because in this changing of the cell, which is picked through the pap smear testing, then you can be able to say, for example, if the pap smear is not normal, what else can it be? I am sure maybe some of us who have done pap smears, you have seen maybe a pap smear result, maybe written something like ASCUS, ASCUS, which basically means maybe, of course, I don't want to go so much into jargon, but sometimes it could be, an atypical cell, but it doesn't have any determining significance. Maybe you have seen a result maybe suggesting, a squamous cell, from the pap smear, you get a result like, for example, high grade, squamous, intraepithelial lesion or HCL, what is called HCL. And when you have a result showing you HCL or low squamous intraepithelial lesion or low seal, it is basically telling you that for the LCL, the change is not as significant or as advanced to raise arms for cancerous or precancerous transformation, but it is a warning sign that you need to repeat this test in a period of about 6 months, because we know the body has healing mechanisms. So if you have a result of a pap smear saying LCL or low squamous intraepithelial lesion, for example, you know that within 6 months, most likely the body's immunity is able to sort of self-heal. And when you repeat, probably in the future, after 6 months, the pap smear result could actually come back as showing no, signs of transformation or signs of changes, and it is basically a negative test, or what is reported as a negative for intraepithelial lesion or malignancy. So you don't have signs in these cells suggestive of malignant or cancerous change. Sometimes if you do a pap smear and you find a results listed as a high grade lesion or high squamous intraepithelial lesion, is to mean that this cell that has been picked through a pap smear is actually showing signs of uncontrolled multiplication, which could be precancerous. But the pap smear itself is not, most of the time, is not diagnostic of a cancer. But of course, and I think Dr. Kalebi maybe might corroborate this. I think in an experienced eye, they can be able to look at cells and see which ones have signs suggestive of cancer. But basically, when you see a result showing HCL, the obvious thing it tells you is, in discussion with your gynecologist, you need to go for more advanced, screening test, which is basically called colposcopy. So colposcopy is basically, examining the cervix under a magnifying lens, a microscope that has a high magnification, to be able to see what changes are actually in the surface of the cervix. Are you able to see maybe increased blood vessels forming within the cervix? Are you able to see maybe changes in coloration of the cervix under this high magnification lens? And the purpose of a colposcopy is basically to be able to determine which regions are actually looking abnormal, for us as doctors to be able to take a small portion, or a small, what we call a biopsy, a small piece of tissue from this cervix that doesn't look normal, so that we take it to the laboratory for the pathologist to be able to determine, is this biopsy, is this cell, showing signs of cancerous transformation or non-cancerous transformation? Because once we make that determination from a biopsy, and we get this what is called histology results, which is basically examination of tissues or cells under a microscope, then we can be able to tell if there is cancer, if there is invasive disease or cancer has already established, what degree of disease are we at? What stage of disease are we at? So basically, one thing leads to the other one. For example, if you do a pap smear, we find something like what I was calling a HSIL, or high squamous intraepithelial lesion, or maybe you find significant changes within the pap smear results, and we go ahead and do colposcopy. We take a biopsy, then we find that in these biopsy results, there is evidence of cancer, and pathologists are actually able to tell us whether in this layer of cells that we took through this tissue that we took from the cervix, has the disease been able to invade all the layers of this column of cells, so that we can be able to tell, because we know the lining of the cervix, which is called the epithelium, has different cell layers, has it been able to invade across all the layers? And this is what helps us to determine, yes, there is cancer, but has it invaded, or is it contained, what is called carcinoma in situ? Basically, cancer that is contained, it's not gone beyond what is called the basement membrane. And after this, now we can do other subsequent tests or investigations like, imaging, MRI, to be able to see how far this disease has gone. When we come back to the issue of the HPV testing, if let's say you get, negative HPV, high risk HPV results, what does it mean for you as a client? It means that within a period of another 5 years, you're supposed to come back for repeat testing. So basically, HPV testing, as long as it turns negative, you're supposed to do this testing recommended every 5 to 10 years. But because of our other risk factors, it's encouraged you do this testing every 5 years. If you're doing co-testing, that is pap smear and HPV at the same time, then the co-testing is every 5 years. Because we know even if you are to get the virus, then the risk of it causing transformation of the cells to become cancerous still will take some significant time, sometimes 5, sometimes 10, sometimes even 15 years. But generally, the body is able to, clear these viruses. And this whole testing also is related to the question of course, vaccination. Because I've also seen some people asking, for example, if I'm not within the age limit that is given for vaccination, should I actually get vaccinated? And the answer is indeed yes. The vaccination usually targets the younger people when they are sexually naive. They have not had sexual debut, or they have not had any first sexual encounter. It's highly effective then, because we think at that time the risk of having sexually transmitted HPV is very low. However, even if you're sexually active, having a HPV vaccination is still very important, because it protects you from potential future infections with different strains of viruses. Remember, we have said there are very, very many viruses, and therefore, the only question is mainly is a cost issue and efficiency or efficacy. If let's say you are 30 years or 35, if you get the HPV vaccine, maybe it may not be as effective as if you did it maybe when you are 9 or 10 years, when you are sexually naive. So the question of HPV testing, I think, should be the message home that knowing your high-risk HPV status helps you to know what next step you should take, whether you need to just wait for another 5 years to redo the testing if the initial test is negative, or whether you actually need to go for, maybe do a pap smear to see whether there are cervical changes, or even nowadays, in the interest of looking at the cost question and also expediting investigations, when you have high-risk viruses, that is HPV 16 and 18, majority of the times we easily recommend our patients or clients to actually do colposcopy and biopsy, because at the end of the day, the one thing that is going to diagnose cancer is not the HPV, is not the pap smear, but is the biopsy results. So that's the laboratory from the pathologist, then we can be able to disease you are at, and you can initiate treatments. Thank you.
Thank you so much, Dr. Maina. Thank you for breaking that down to us. And I believe we've been able to get the understanding. Thank you for clarifying those difficult terms. You know, just to recap for the audience, when you talk about the LSIL, these are just basically mild changes in the cervix, and they can clear on their own. When you talk about the HSIL, we are talking about very significant changes that will need close follow-up. So you need to see the doctor, will need further investigation. So thank you so much for those reactions. Allow me to quickly invite Jennifer to just say something to us. Yes.
Just before we invite Jennifer, so
Okay.
she can, I just wanted to summarize 3 points
Okay.
because Maina said quite a number of things. I just want to summarize 3 points, which for emphasis based on what I'd said and what he has said. Number one, and I think that's a very important message for this audience, and it's something that a lot of people, even doctors, are not quite familiar, and there's no shame in not knowing something, but now you should know. From 2019, Ministry of Health of Kenya has recommended that HPV testing should be the primary screening. Over most countries are now doing HPV. Government of Kenya says HPV DNA testing should be the recommended, and in 2014, it has actually now become the recommended testing method. So people are still doing pap smear, and it is not supposed to be pap smear for primary screening. Why? Because as Dr. Maina said, there is an issue of how sensitive, how accurate are these tests. So there are 3 main testing methods. There's HPV, there's pap smear, and there's what we call VIA. Now, pap smear, unfortunately, and I can tell you as a pathologist, it is not that accurate. It can miss up to 40 to 50% of precancerous lesions. So it has about 50 to 60% sensitivity or accuracy, which makes it not a very good test. But it was the only good test we had until HPV. Why can it miss? Because if you fail to pick the cells from inside the cervix, and that's why pap smear requires speculum. I believe we are all adults on this call. Inabidi mwanamke ajipanue, vile wanasema, iwekwe speculum, which allows somebody to look into the cervix inside, pick the cells, and if you don't pick the cells at what we call the transformation zone, you will miss the precancerous cells. That is why we have to do pap smear frequently, every year to 2 years. And that's why sometimes you do a pap smear and you are told it is not good enough. On the other hand, HPV is fairly ubiquitous. If it is there, you'll pick it in the sample. And you don't need to get a cervical sample, you just need to get a vaginal samples because it is shed into the vagina. So I want to emphasize that HPV DNA testing is much more accurate for cervical cancer screening. It is the recommended by international and national guidelines. And finally, it is much more convenient. It does not require colposcopy. So it does not require a speculum. It does not require you to go to a healthcare worker. You can even do it from the comfort of your home. Dr. Maina talked about cervical cancer screening in Kenya being less than 20%. In other places, even less than 10%. I'm sure if we did a poll among all the women here, and you can feel guilty for those who have not done it and do it tomorrow, majority of you have actually not done cervical cancer screening of any form. But I can tell you HPV is recommended. Now, in the UK, for example, they have more than 90. In Australia, they have more than 97.5% screening, which is because of HPV testing. So I really wanted to bring that and hit it home. Thank you.
Thank you so much, Dr. Kalebi. And just to share what one member of ours who came to your labs and was able to get a sample for themselves. I think at this point is where I read what she had to say. So allow me to read it so that we can also help to emphasize the importance of having the HPV DNA testing and the convenience that comes with it. You know, women have complained it's very invasive, it's very intrusive, it's very cold, you know, there are all those complaints. But let me read what she wrote. She said that taking my HPV DNA test felt like reclaiming my power. I had only learned about it a few weeks earlier, but walking into that washroom and taking that sample, simple quick swab, felt like a massive step towards putting my health first. It wasn't nearly as invasive as I expected. It was much easier than a pap smear, and the whole process was over before I even had time to worry. Handing in that swab was a moment of pride and courage. It felt like saying, my health matters. I am taking charge. When the results came back just a few hours later, it really hit me how accessible and manageable caring for yourself can be. If you are hesitating or unsure, so this is a call to action to all the women here. If you are hesitating for or unsure, remember, your well-being is worth that small moment of courage. Step up and do it. It is potentially a life-saving test. Thank you. All right. So in the efforts of being able to encourage all of us to go for screening, I would like Jennifer to just unmute and then just tell us a little about how her cervical cancer was first diagnosed, and even probably share one key moment in her journey that really stood out for her. So Jennifer, maybe you can talk to us and tell us, even as we watch out for the time, we are listening to you. Over to you, Jennifer.
Okay, thank you very much. I think this is the second time I'm talking to this group, maybe someone out there. As I've said, I'm a cancer survivor, cervical cancer survivor. I usually say I survived twice. Why? Because in 2014, I was diagnosed the first time. I went for treatment in Nairobi. And after treatment of around 3 months, I was told it's clear, but I was encouraged to be going for further tests, continue monitoring. 2017, that is 3 years later, I was told there's a recurrence, and I started all over again with the treatment. The treatment is usually not very easy. I went through chemotherapy, radiotherapy, brachytherapy, but when it came in the second time, I had to do a very major surgery. So I did what they call radical hysterectomy. The doctors will correct me if I'm not right. From there, I decided now I will not keep. At first, in 2014, when I was diagnosed and treated, I kept quiet. Why? The stigma. It is cervical cancer. It is transmitted because you have done a lot of sex, doctor. That is what they believe. And today I've had a lot of information, and now I know anyone can get it, including a priest and anyone else. So stigma, I kept quiet for almost 3 years until now I was told that I'm going to go for a major treatment, a surgery you will have to tell people because now you're going to be admitted in hospital. It's a major one. You'll be bedridden for some time. And that's why I decided to come out. The treatment went well, and I think that is the time we met, 2017, for biopsy. And I went with the treatment and went well. In 2018, I did a PET scan somewhere in March, and I was told I'm free. I've done PET scan around, I think, twice now, and the doctors always told me I'm okay. Now, why did I decide to come out? I decided to come out because most of the time when I'm somewhere and people are talking about cancer, you hear people saying, like, for example, a colleague of mine, she was like, I saw somebody who died of cancer, alikuwa amekonda sana, and if I have cancer, I don't want to say. I will just wait and it kills me. And then I was like, no, I think I should say something because I heard it and I'm still alive. So I decided to come out. And most of the time, the challenges we usually get is immediately you are in a group and you tell people, I'm a cancer survivor. everybody goes quiet. Everybody wants to know, what did you do? What happened? Most of the time when people are very sick, especially cervical cancer, with most of the women, especially the older ones, you find that they don't say it. They don't share until they are very sick. So most of the time you're divided by their kids to go and talk to their parents and tell them how they can fight back the disease. But most of the time is usually very discouraging. Why? The disease is too advanced. So that's why I decided to come out. And in 2019, I decided to register a foundation. So what do? We create cancer awareness, mashinani. We usually go to those tiny areas where roads are still under maram, dust roads, and tell people this. And when you go there, you still get people with cancer, cervical cancer, especially breast cancer. And then what does that one tell us? Cancer ibagui. It is everywhere. Cancer, again, it is not witchcraft. And people, guys, don't wait until you feel something to go for testing, to go for the diagnosis. You will not feel anything. Cancer is not painful until it is too advanced. When I decided to go for that particular test, I wanted to do my own things. I wanted to exit teaching and do my own things. And that is the time I discovered I was sick. And it was already stage 2. And I didn't have any pain. So guys, don't wait. Don't wait until you feel something. No, don't wait. Go now. Last year with my foundation, we raised some funds with our governor in Mombasa, and we tested over 70 women, HPV DNA tests. And for sure, that one was really, really a big change. Why? Women were given the swabs, going to the washroom and coming with their kits to hand over to the doctor. And guys, it is working. And that is the only way. In those over 70 ladies, only about 4 were caught with the high-risk viruses, and they were treated, and they are okay. And we are together pushing with life. So why is it that we need to talk and we will never keep quiet? Because people are dying. People are taking it like it's a joke. Guys, it is not a joke. And we don't want you to be scared. Don't be scared. Don't be scared. Why? It is your life. You need to take control of your life. If you plan to go to the shamba, you'll prepare some things so that you'll be able to get a good harvest. So if you're looking forward to seeing maybe, like the doctor who was treating me the second time, she told me, I want to treat you so that you'll be able to see your last born going to university. I was 38, sorry. I'm 50 now. I'm still around. My last born is in the university. So it's like a shamba, it's like a garden we are preparing. So if you are looking forward to seeing yourself in future, you have to prepare this shamba of yours, this life of yours. Go and check your breast, check your vagina, check your cervix. Anything that comes in your body and you don't understand it, go and check it, don't wait. Now if SHA is catering for this, then now that is the way to go. And Dr. thank you so much for giving us the highlights. I've heard about the HPV DNA testing from a different perspective, and it is very clear. People need to go and test. Why? It is the only way to prevent cervical cancer and to make sure that people survive. Now, what has come out as my highlights in this journey is that immediately people hear the word cancer, the people hear the word cancer survivor, they'll always get scared. Why? The stigma. So the stigma is what has really surprised me. People are not getting the idea of why we need to check. My doctor told me, imagine that it's just malaria. And it was not easy for me to believe it was malaria. But she told me, if you're going to get to start imagining that it's something big, you will die, Jennifer. And then I was like, Hey, you serious all day? Yeah. Imagine that you're treating malaria and fight malaria, fight like any other disease. So please, guys, early diagnosis, early detection saves life. So where do we go? Let's go to the labs. Dr. has already told us that in his lab, you don't need to go and see the doctor. They'll be able to get the samples and they'll test you, give you the results. And we have Dr. Maina who you'll be referred to him and he'll take care of you. Thank you so much for this opportunity, for listening to me. Let's continue talking. Thank you.
Thank you so much, Jennifer. Let's show a hand of appreciation to Jennifer. Thank you so much. We appreciate Jennifer for sharing your journey and always being ready to come and talk to us at the Rotary Club of Nairobi Thika Road and Rotary in general. So I want to quickly request Dr. Kalebi to probably just in brief, as it is also your parting shot. I see most of the questions you've answered them in the public chat, and we will continue to request participants to ask their questions, but I wish you can just tell us about the process of the HPV DNA. I show up at DKL labs, then what? So we just need you to tell us about, because now already are convinced that it is very important for us to have a HPV DNA test done. Over to you, Dr.
Actually, this might sound like stories town. That's not stories town. Like it's history town. You actually don't even need to show up at DKL. Because I wish I knew I was supposed to present. I'll have come with that kit. And as I told you, I'm having dinner at my daughter's, so I don't have it with me. But it's basically a swab. Imagine the earbuds. It's almost like that, but it's a bit longer. It comes in a nice container, and that is then can be actually sent to you, or you can pass by and pick it. In fact, in places like Australia and the UK, it is mailed to you, you collect the sample and you send it back. So you don't need to come to our lab. Of course, we are very happy to have you come to the lab. When you come to the lab, you say, I want to do a HPV test. You are given the form, you fill your details, you are given the kit, you go to the washroom, collect the sample. It's as simple as literally inserting. It's even easier than inserting a finger into your vagina. It is thinner than your finger. You just basically insert it and put it back into the container. It's a small container, and that is it. Sorry to use examples, but we have, you see there's a show coming up on NTV on this Sunday, which was actually directed by produced by your president, and that's how I ended up in this talk. And I can say her and her colleagues who are in that session, I actually made them do it. And I remember, I can quote her. She says she felt liberated. It was so easy. I hope she'll be able to comment about it in her parting shots. But it's that easy. Literally few minutes and you are done. Now, if you are at home right now, you can literally go on our website, www.dkl.co.ke, and you can order a test online. It's like ordering for something on Amazon or I don't know what. You can literally go order for the test. If you are very savvy, you tech savvy, you can download our app. Once you download the app, you register. You can order online. Once you order online, you will send you the kit. You'll have the sample collected. You drop it, and you'll get your results back securely on an what's it called, OTP enhanced or OTP enabled password that allows you to be able to view your results. Now, for the Rotary, it's going to be much easier because we will give the Rotary team all the kits. They're like, I tell them, like they're like lollipops. You know, we'll give them in a box, and you just dish out to any woman you meet in Rotary. Go pick it, have the kit collected. Ikifika kwa lab, tunaingiza kwa system. We send you a message for you to pay. You pay online, test inafanywa, unapata results zako. It's as easy as that. How does the test work? The test works in that the tip of the swab is what we put in a machine. The machine is from Roche. It was the first FDA approved machine for HPV testing. It can detect type 16, type 18, and 12 other subtypes. So it's able to do what we call genotyping and say this is the exact subtype. As Dr. Maina says, if you have the high risk type 16 and 18, you don't waste time. You go straight for colposcopy. Colposcopy means they actually examine the cervix, and when they examine the cervix, is there anything they can see, they take a biopsy, which means a small piece of tissue. If they see something bigger, they even cut all that what they see. If they don't see anything, they'll collect some cells and that will be examined. So it's a very, very easy test. Unlike Pap smear, which takes days sometimes for you to get a report, this one for us, it takes about 4 hours on the machine. So you get your results same day, by evening, or next day. It is that simple. So for you who are Rotarians, I had many stories about doing good and everything. You must start first of all with yourselves. Anza kujisaidia mwanzo, test yourself, then after you have tested yourself, tell your neighbor to tell a neighbor. I usually tell women, no woman goes telling another woman that, hey, I nilifanywa Pap smear, because it's such a traumatic experience. But I can tell you with the HPV, as Jennifer will tell you, when we did a camp with them, the women were so happy, they're actually coming and telling other women, come, there's this easier way. So it is something you can actually do yourself. And I was even telling Ruth that literally we can give you the packet when you're going for Christmas at home. You can have like maybe 20-30 swabs. Unaambia kila mtu nyumbani, we shika hii. And that sample can stay for weeks. You can pick it, bring it back home to Nairobi, ukienda Gishagi. So no problem at all, as long as the container is still intact. I can see the president is saying it literally takes seconds. As long as the container is still intact, we'll be able to test for you. So that is basically the parting shot. It's an easy test. You just come, you can come to us, you can ask for it. We have people that we work with everywhere. So we can actually direct you wherever you are in the country. We'll tell you, go to the nearest facility where they'll be able to give you the kit. It's that simple.
Thank you so much, Dr. And I have something I want to share in that regard. So let me try and share it. I hope it's going to shed some light.
Somebody's hand is up.
Just a minute. Are you able to see my screen? What I'm sharing?
It's coming up.
Anyone able to see my?
Yeah, it's up.
It's up, all right.
Yes, we can.
The swab, the sample, and I'm going to insert it into this envelope. And imagine that it's as simple as that. And I'll get to know whether it will be positive. So, early detection symptoms. This has taken me less than 30 seconds here at Dr. Kalebe Lab. So anyone can come, ladies, I urge you, please come and get your HPV DNA status. Early detection saves lives. Thank you so much, President Ruth, for leading from the front. I believe we've been able to follow that. I would like to invite Dr. Maina to give his parting shots as we respond to the hands that are raised.
Hello, thank you everyone for keeping the discussion alive, and Rotary Ethical for organizing this. And of course, Dr. Kalebe, I hope he can give us discounts in this club. I can't overemphasize.
Right away, there is a discount, good discount for Rotary, which has been negotiated. I've even put it in the chat. So there is a discount for all the Rotarians, and it will be applicable for the whole of December.
Thank you so much. I hope all Rotarians take advantage of this great offer by Doc, because as the conversation has evolved over the years, the key focus currently is basically HPV testing. I don't think I can overemphasize that point of screening, HPV DNA PCR screening. Hopefully in 2026, we don't have any more deaths from cervical cancer that is preventable. I wish you well, and I hope you guys you take up this test. If you have any unusual results or whatever results, you can talk to us. We can guide accordingly. And thank you.
Thank you so much, Dr. Maina. I'd like to invite Jennifer. Thank you so much, Dr. Maina. I'd like to invite.
Hello, Wangeshi. I don't know whether you would like. I saw a colleague of mine here who is a gynecologist working at Naivasha, a Rotarian herself. She's called Dr. Njeri. She maybe might have one statement to empower the discussion.
All right. Rotarian Njeri, maybe you can come and say something for a few minutes. You can unmute and share.
It's an honor. Thank you, Dr. Maina. Actually, I'm a Rotarian from the Rotary Club of Naivasha, and I got to learn about Rotary through Dr. Maina, so I'm forever grateful for that. Thank you for the session that we've had. It's been very informative. Even I have learned some new things today. So thank you to Dr. Kalebi, and thank you for the team for organizing this. I cannot overemphasize what has been said by both Drs. Kalebi and Maina. Cervical cancer is 100% preventable, 100% treatable in the very early stages. And so it's a call that we always make to women to have your screening every other time. I know there is a fear of the results, but then again, as Dr. Kalebi said, you just don't let the ants chew your wood. So it's better if you always know, because if you know in the very early stages, something can be done about it. And if you're actually if you're negative, then you're negative. So it's just a call, a continuous call that we're going to continue making to all the women to get screened, have your little ones, the young girls vaccinated, because for sure we can't be able to eliminate cervical cancer like some countries in the West have. So don't fear, just go in. New innovations have come in, as you've heard. You don't need to do a speculum. The fear of coming to a gynecologist and as being very invasive, at least that one is now getting eliminated. You can collect it at the comfort of your home, at the comfort of whichever washroom that you have, and send the results to the lab, and you get your results back in time. So it's just basically the same call that has been made. Let's get screened, let's get vaccinated, let's prevent and treat cervical cancer. Thank you.
Thank you so much. Thank you so much. Let's give Rotary Njeri a hand clap. Thank you so much. Jennifer, parting shot.
Yeah, I would thank the whole group, the organizers, for calling me the second time. I'm ready for third time, even the 10th time. We are going to pause, at least even if it's only one lady, to go and test and be free. And I would wish to request the doctors, especially the Dr. Kalebi, so that if this one can be taken further. Now that if SHA is financing and you have the facility, maybe you come up. I've not seen that in Mombasa. I've not seen a detail in Mombasa. We can do something. We can talk and see what we can do. Then we also need to move to those remote areas. There are areas whereby when a lady is diagnosed with cancer, is communicated, taken away from the village, from the family, because it is witchcraft. So let's take this one further. That would be my prayer. And thank you everyone who has listened to us. And let us not just listen. Don't just listen to us. Take a step. You've seen the clip where the president was taking the pap. It is as simple as that. Size yake ni ile kitu ya kuweka kwa sikio. You go do it yourself, put it there, and you get your results. And I believe it's by your phone. Thank you so much, Dr. Wangeshi. And I wish we can do this often. Thank you so much. Be blessed.
Thank you so much, Jennifer. Thank you so much. Aisha, I have seen a hand raised by Aisha. Maybe you can ask a quick question as we want to wind up because we are past time. And as Aisha unmutes, kindly I'm requesting you to go back to slido.com, enter that code, and then just give us your remarks. You know, we have been doing this webinar series, and we would like to hear from you. Has your understanding been able to be enforced, and what would you like to share with us? Please, we kindly request you to give us your feedback. Over to you, Aisha. All right. And we have a few questions that we would need to respond to. For instance, we have our district membership chair asking about us being able to collect data on how many people will be tested from this great initiative. So we are going to liaise with Dr. Kalebi to be able to get the numbers, not the data, but the numbers of those who are tested, just to be able to measure our impact. And I'd like to quickly say that we are okay. Yes.
Can I
Yes.
just answer three very quick questions? The first one was, are we in Mombasa? Yes, Dr. Kalebi Labs is in Mombasa. We are, we have a branch. We work branch through partnerships. So we have a partner in Adena, which is just above CJ's on Nyerere Road. So if you are in Mombasa, you can actually go to CJ's, just above CJ's. However, I can tell everybody who is listening, we can have samples collected anywhere in the country. Whether you are on top of Mount Kenya or in Lake Victoria or in the coast, just contact us and we'll be able to organize for samples to be collected. And in the case for HPV, we'll be able to give you the kits, collect your samples, and then the samples will be brought to Nairobi at no extra cost, and you'll be able to get your results. Number two, when it comes to the issue of SHA, SHA covers 100% at no extra cost for civil servants, teachers, public officers, public officer medical service fund. For the kawaida wananchi, they are yet to activate the full cover because of budgetary allocation. But if you have a request from a doctor, they cover for it and they pay, as I said, 3,990, which is low, but we take it. And anybody who comes to us, we can ask SHA to pay, and if they don't pay, we give you a discount. Although we usually do the discount during the campaigns, but you can come to us anytime. You can, but let me just emphasize this. Even at the standard cost of 5,990, which is basically 6,000, it's literally, if you do look at it that you're doing it 6,000 shillings in 5 years, you don't need to repeat for 5 years. It's basically 1,200 shillings per year. It's basically 100 bob a month. That is less than the cost of the extra meals that you eat and get mafuta. So just and facts, do the tests, eat less, and you have your cervical cancer testing. Sorry, I'm just putting it as it is. Polyrispa. Yeah. And finally, I can see there are so many questions that are being asked about treatment, about the implications of management. I think I won't answer them, and I don't even think Dr. Maina will have the time to answer them. I really want us to change our mindset. I want us to change the narrative. The narrative is not about getting cancer and getting treated. Those people who are sick, they will get treated. Somebody needs to be muted. Okay. Here, we need to think about it that screening is for the people who are well. So if you are currently well, you don't have any symptoms, this is the time to have yourself screened. And the government recommendation, the international recommendation, the easy way of screening is to do a HPV test for cervical cancer screening. And I will finish off by saying cervical cancer screening is the only way, and the only way that has been proven beyond doubt to be able to prevent a cancer 100%. So it's on all of us, whether you are a woman with a cervix, or a man who has women in their lives with cervix, or a parent whose kid is gonna eventually become sexually active. This is a message for you. Let us go for cervical cancer screening for all the people we love. Thank you.
Please tell us where your lab is in Nairobi, Doc. Someone asked.
My lab is at, I think the easiest thing in this day and age, just search Dr. Kalebi Labs, DKL, you'll find it, but we are just next to Kenyatta, basically 280 meters from Kenyatta Gate. The building is called Real Towers Annex, but it's much easier to find it on online. You can even check on Google, Uber, it's very easy to find it. But as I said, I know not everybody is in Nairobi on this call. You can download our app. I've shared the link, or you can go on our website and you can order for the test wherever. We have a 24-hour call center. We operate 24 hours a day. I can share with you guys a number which is very easy: 0750 333 000, and I'll put it on the chat: 070750 333 000 stroke 0769 333 000. If you contact us through that number by WhatsApp or call, is 24 hours. You'll be attended to wherever. Even if you are in the farthest corner of the country, even in Mandera, we'll be able to assist you. Thank you.
Thank you so much, Daktari. Let's appreciate our doctors. I want to say thank you from the bottom of my heart for heeding to the call and coming to support in this sensitization campaign. Back to you, Prezo, but I'd kindly request us to give our feedback, because it is very important for us to be able to improve on our future series. Thank you so much. Over to you, President Ruth.
All right. Many thanks, Dr. Diana, for that insightful and well-organized moderation. We really, really appreciate for breaking it down in a very, very simple manner. I'm told we have Lucy Mithu on the call. Lucy Mithu, if you're on the call, just unmute and say hello to us in less than 30 seconds.
Thank you very much. Hello, everyone. I believe the
Hello.
30 seconds are gone. Happy to join and the interesting discussions around it, and also the call to action. Like everyone has said, cervical cancer is cancer that is 100% preventable if we take action. Thank you.
All right. Thank you very much.
So,
I can confirm.
can I just say, Ruth, that disclaimer, or let
Yes.
me proudly say that Lucy works with Roche. She's actually a champion for lab testing and cervical cancer testing and so on. She's actually the one who connected me for all this. She's also actually on my case behind the scenes. So you can't say it, but me, I don't shy saying it. Actually, our wonderful machine and the wonderful technology is thanks to this beautiful lady called Lucy. So thank you very much, Lucy.
All right. We appreciate, Lucy, for all the support that you have offered to Dr. Kalebi, as well as our club behind the scenes. A lot has really gone in it. I can confirm firsthand that I went to Dr. Kalebi Labs. Very, very modern facility. By there, I was really wondering if this is actually in Africa. And he conducts over 3,000 tests, by the way. So if besides HPV DNA test, if you have any test around DNA, paternity, and all that, please go visit his facility. He was very, very welcoming, and well done, Doc, for setting up a world-class facility right here in Nairobi, Kenya. Now, the discussion does not end here. This Sunday on NTV, on a show called Health Diary, we'll be having a continuation of this. And he's even going to be demonstrating further on how the swab is going to be done. I went to the washroom, 30-second swab, put it inside a container, and there was an app. Checked the app, and in the afternoon, my results were out, and they're good results. So thank you for that. It's a story, Ajaba. It's a very true story. I hope we can play that promo that Timothy, if it's ready, please play that promo for the show that is going to be airing this Sunday. Please tune in on NTV from 6 p.m. Yes, there it is. Audio.
People have had it, have interacted with it. It's a virus that causes skin warts. The skin warts can happen on the skin. But more than 95% of HPV will clear it. There is an unfortunate 5% who will fail to clear it, and those are the ones that are actually competing because cancer.
But the moment you want to hear about it, and this is really the work of Rotarians, is then put it out. So this forum is really to get out to understand that HPV DNA testing is available.
a swab. Oh, it looks like, almost like an ear, but then collect the sample because you are looking for the virus.
Every Sunday at 6 p.m. only on NTV.
Thank you. You've seen that, so please tune in as the Rotary Club of Nairobi Thika Road. Our work is to create awareness and to ensure that we are connecting you to the best of the best when it comes to the industry players. A big round of applause to all our panelists who've been able to join in, to all of the 130-something guests who are able to tune in for this important discussion. I say thank you. To the over 30 clubs that joined in today, I truly, truly appreciate the time that you've taken to listen into this very, very important and insightful conversation. We are running the hashtag Early Detection Saves Lives. So please do not be a statistic. Take charge of your health and please go and get tested at Dr. Kalebi Labs. He's really offered us a very good discount of 4,500 shillings. He can even get lower. I'm sure with Lucy and Brenda on the call, we can negotiate even further, but that's subject to confirmation on a later date. In line with the Rotary protocols, as we're coming to the close of this meeting, I'd like to thank each and every one of you who has joined in. There's a link that has been shared on the chat box. Please fill in the survey. We just want to measure the impact of this webinar, because we plan to even have more webinars around areas on disease prevention. And because we need to record that indeed we attended this particular webinar, please put on your video. Dr. Diana is going to take a screenshot of the participants. Yeah, and share it with your friends that you attended today's webinar on understanding HPV DNA testing. So on the count of 3, 2, 1, please smile or wave. All right, I can see your lovely, lovely smiles. So to the Rotarians and to the non-Rotarians, as we end our fellowship, we normally put what we call it the loyal toast. So we request you all to please place your left hand across your chest. And in conjunction with all the 30 clubs that have joined us this evening, as well as our guest, I give you Rotary to the world over. Rotary, the world over. I thank once again. Thank you. Thank you. We shall continue this conversation also on our social media platforms. Doc, please drop in your social media platforms, as well as Dr. Maina, as well as Jennifer, and where we can find you. Yeah, and thank you. Please continue clapping because this has been a very, very insightful talk. Brenda, you have your hand raised up, as well as
Yeah,
two more others.
yeah, because we'll need to end the call. You can just save the form, you can save the link and keep sharing feedback. Thank you.
Okay. Thank you. Mercy Mwende, I see your hand is up. All right. So our fellowship has officially ended. We will be sharing the recording once this is over. Thank you once again. Thank you to all our participants. Thank you to all our panelists. Thank you, Dr. Diana, for hosting this very, very lively and insightful session. I wish you all a lovely evening. God bless. Bye. Feel free to leave the webinar.
Thank you. Bye-bye.
Bye-bye.